Good morning. I'm Dr. Murali Mohan from Hyderabad Laser Surgery Hospital. Today I'm going to explain you what are the most common problems you see in the bottom. The most common things you see in the bottom are fissure, piles, abscess, and fistula. And today I'm going to explain you what they are means and what are the differences. Fissure means cut. So when you pass hard stools or there is any sharp object in the stool, it can cut your bottom, right side, left side, front or back, but mostly it happens on the back. The problem with fissure, why it arises means like you can get a cut on your body any number of times, 100 times in your lifetime, you cut 1,000 times, but you don't see any problems. Why does this one give you trouble? Because we have there what is called sphincter, the one that prevents leakage of the. So when there is a cut, to pain you, and what will happen is to hold it tight, very tight. So when you hold tight, two things will happen. One is severe pain. Second thing is when it hold tight, the blood supply will be decreased. So it is getting less blood supply. So it cannot heal. So that we call it fissure. The next common thing you see is piles. So what are the piles? You know there are blood vessels every part of the body, and usually they have two type of blood vessels. Important. One is the one that takes blood from the heart, and the second one is that one takes blood from to the heart. Okay, so piles affects the one that is taking blood to the heart. In the bottom you have blood vessels. So vertically, so you can see the blood vessels. So where these blood vessels are, they are right the bottom, they are right under the skin. In the higher up, right under the covering of our bowel. So all the bowel is covered with something inside. I don't see inside what is. When they become bigger, so these blood vessels, if they become bigger, so each blood vessel can become like, usually they are 2 millimeters, 3 millimeters. Now they can become 15 millimeters, 20 millimeters. So when they become big, is going to bulge. Then we call it a piles. So that is the second condition we see. The third one you see is abscess. What is the abscess? Abscess means collection of a pus. Is called abscess. So we call it perianal abscess. That means any pus collection around the anus, near the anus, is called perianal abscess. It can be within the walls of anal canal or outside of it. So any collection is called abscess. So usually it happens between the two sphincters. You have two sphincters. One is internal sphincter, other one is external sphincter. The external sphincter is actually what we have the normal control. You feel the tightening, that's the external sphincter. So there will be anal glands here. What they do is, like if you are sitting under the fan, you see sticky thing, oily thing on your skin. There are similar glands in the anus called anal glands. So when they get infected, pus will form like this. You can see this is a pus collection. So this is the most common thing. You can also form other areas. So this is perianal abscess. So next one is fistula. What is a fistula? Fistula is a connection between two surfaces in medical term. So fistula is like inside the anus and on the skin. So it is a connection from inside to outside. It is called fistula. So abscess is collection of the pus. Then fistula is connection two places with a canal in between. Okay, now we got that. Understand what the four are different.